Hello, my name is Dr. Dmitry Tsvetov, and today we're going to talk about the cost of dental implants. I'm sure a lot of you are wondering why is it that from place to place you can have such a huge variation when it comes to the cost of dental implants. You have places that are advertising cheap or affordable dental implants for as little as $800 a piece, and you have places that are charging up to $5,000, sometimes even $10,000 for a dental implant. So hopefully after you see my presentation here today, you will have a little bit more of an understanding what goes into determining the price of the dental implant, and you will be a little bit better informed when making the decisions that affect your oral and your dental health. Before we begin, I think it's important for us to understand what a dental implant is, because that really determines the cost of the dental implant. When we look at the components of the dental implants, we see that they actually consist of three parts. There is the implant body, which is the part that is placed inside of the jawbone. There is the abutment, which is the part that the crown is attached to. So it's actually three separate parts, and that's the first step in understanding the cost of the dental implant. You have to be sure that you understand what you are paying for. Are you only paying for the implant part that goes inside the jawbone, or is the price advertised for the whole thing? Because as you understand, you can have some practices charging a very low fee for the part that goes into the bone, and then the costs will start adding up once you start talking about the abutment and the crown. So the end result may be the same, if not higher priced than average. Here's another look at the components of the dental implants. You have the part that goes into the jawbone, the abutment, and the crown, or the white part of the tooth. And just to complete the picture, we see x-rays of the three different stages of implants. You have the part that gets placed into the bone or the implant body. You have the implant with the abutment, and you have the whole thing, the crown, the abutment underneath, and then the dental implant itself. What you need to understand is that there are many different implants out there. They're all made by different companies all over the world. Even the material itself that the implants are made out of, being titanium, can be of very different strength or grades, and some implant companies may be using cheaper materials, others may be using better materials, and that also plays a lot into the cost of the dental implant. Just for the practitioner to order an implant can cost anywhere between $50 to $500, and so obviously the better implants will cost the practitioner more, and the cheaper implants will be cheaper. But to you as a consumer, an implant is an implant. So the first important lesson to understand is that you have to be aware of what is being placed into your mouth. Is it a cheap implant, or is it a quality implant? Because again, not all implants are created equal. Implants are like cars. We all want the best and the greatest. So we can compare a dental implant to a BMW. Well, we all want a BMW, but one cannot expect to get a BMW for the price of a Geo Metro. If you want a BMW, you need to pay for a BMW. If you're okay with a Geo Metro, you can feel comfortable that you can pay for a Geo Metro and get the product. But you understand that the two are not equal. The same is for a steak. If you want to go to a nice restaurant and have a nice piece of steak, it's going to cost you a little bit of money. If you're comfortable with this, that's great, but you cannot imagine the world where you pay for this and you get a nice piece of steak. It just unfortunately does not work that way. So as we discussed, there are many different implant companies out there, and they all use their own proprietary technology, proprietary parts and pieces, including the screws that secure the abutment into the implants, the little screwdrivers that are used to tighten those screws, and the torque wrenches that are used to check exactly how well that screw is tightened inside of that implant. So let's look at a few examples. Again, we're going to be talking about the parts and pieces that go into the implants and the screws that are being used to secure the abutment to that implant. And here's just a cross-sectional view, the prosthetic screw that is being tightened inside of that implant, holding this abutment in place. Wide variety of screws, a wide variety of the wrenches to go with them. The wrenches can be flat, they can be hexagonal, they can be square. And of course, you also have the torque wrenches, which are the tools that are used to measure exactly how tightly that screw is tightened inside of that implant to make sure that the abutment does not get loose over time. The reason I bring this up is because one way to save on costs is to use the cheapest available parts that are out there. So occasionally what happens is practitioners would use the cheapest wrenches, the cheapest screws, instead of the brand names. Well, not only are they not designed to fit well together, they're also not going to provide you a long-term positive result. So in situations like this, you end up with a mishmash where the different parts and pieces are used to make one product. And well, one way to look at this is it's a stretched out limousine, but I think the majority of people who look at this would say this is just a bunch of parts and pieces that are placed together that don't fit together too well. So make sure that whoever is doing your dental implant is only using the parts and pieces that fit and that go with that implant, that are hopefully made by the same manufacturer as the implant itself, and that they're used correctly so that you prevent the problems from happening in the future. What kind of problems can you have if you have the parts and pieces that don't fit well together? Well, you can have implant fracture, you can have the screw itself fracture, and what you end up with is a piece of titanium in your jaw, which is a very well integrated. It has fused very well to the jawbone. The problem is, at this point, you cannot use this because the top part broke, and now, as I mentioned, you have a very expensive piece of titanium sitting inside of the jaw. So just to summarize, you want to make sure that you ask your doctor what implant systems do they use. With a variety of implant systems out there on the market, truly there are only about 3 or 4 implant systems out there that are market leaders. These are implant companies that have been around for 50 or 60 years, ever since the invention of the dental implant technology. These are the companies that have a vast majority of research about dental implants, and they have been doing this research for the last 50 or 60 years. And you can rest assured that if you need a replacement part, a replacement screw, or if anything goes wrong with those implants, that the parts and pieces will be available. I can tell you stories about the situations where the patients have had a certain implant placed and this company is no longer in business. So if you need a prosthetic screw to tighten the abutment, you're out of luck because there are just no parts and pieces available for that implant anymore. So then you're really in a tight situation. Also, you have to ask your doctor about what is included in the cost. Make sure it's very transparent and you understand, are you only paying for the implant body itself, or are you paying for the implant, the abutment, and the crown? So I hope my presentation has been informative. I just want to finish up by telling you that here at Temecula Facial Oral Surgery, we offer free dental implant consultations. It's not going to cost you anything to come in and to speak to us. X-rays are free, including three-dimensional imaging. We would love to see you in the practice. Just please give us a call, make an appointment. We can address any concerns that you have, and if you need any more information, please feel free to give us a call. Thank you and have a nice day.